We have several enemies in the world, but one is very striking, the Nigerian Medical Association. That will be the focus on Insight Today, discussion segment Full Blast. The president of that association is with me on set. Dr. Francis Faduyile is the president Nigerian Medical Association. Beyond this, before even becoming this, is because of this, he is the associate professor and consultant pathologist, Department of Pathology and Forensic Medicine, Lagos State University College of Medicine, Ikeja. Thanks for joining me on Insight.
Thank you very much.
Would I say congratulations?
Yes.
And if my records are correct, this must be your second media outing shortly after you became elected president of NMA.
Yes.
Okay, let me start with this. What is the position of the NMA regarding the ban on codeine-based cough syrup in Nigeria?
Well, certainly it's a welcome development, and I may want to commend the federal government for that bold step. However, we see that that is not enough to take care of all the other drugs of abuse, and also even these codeine drugs that are used for cough syrups. We want the government to make sure that they expedite action on the prescription right, because many of these drugs are out of over-the-counter drug, and we want to control it by the time it is only the medical doctors that can prescribe, and with that we can control many of the drugs of abuse. Very close to us, even in Benin Republic or Togo, you cannot just buy a lot of drugs over the counter. You must have a prescription. With the prescription right that NMA has been in the forefront, it will stop a lot of these drugs that our youth and some of our elderly populace are abusing generally.
Okay, when we talk about to expedite, is this coming up with a reviewed law or a new regulatory framework on it? Because we know that there are certain drugs that are banned, but we are also aware that the codeine-based syrup are not captured within the narcotic, the banned drugs kind of. How do you mean?
Well, it's not only codeine-based syrup that the drugs of abuse. We have so many of them, but the problem is the ease in which they can be purchased. Even if the codeine-based cough syrups are being sold and it is under prescription, it then means that the doctor or whoever prescribes it can be held liable for such a large dispense of those drugs to the would-be abuser. We have other drugs that we use daily that are also abused. Do we say we stop that? The long-term goal is for the government to know that it is important we have this prescription right, that it is only drugs that are in these categories of drug that can only be sold once you have prescription. That one can put a tab on all these drugs, and we can follow up where these drugs are dispensed to. Okay. However, as it is, NMA welcomed the idea of banning the codeine-based syrup as it is, but the longer term action that we expect is for the government to make sure that we have this prescription right for doctors.
Should it be only the government alone? Do the citizens not also have a role to play in this? Because the point I'm making is, if government say, okay, we have banned, okay, we have come up with a law, okay, we have given a prescription right to this, and at the sales point, it's a huge structure, right? It's a huge platform. You have the pharmacists, you have the what we call the chemist, the sales outlet. Who qualifies to own a sales outlet of this magnitude? How are they regulated? Because as we speak, we have difficult to reach areas in Nigeria, communities.
Thank you very much. This is part of the legal framework that we need to strengthen the health system and health indices in Nigeria. It is important for us to know that once we have a legal framework that made it difficult for some drugs to be sold to anybody, either you are a chemist or you are a patent medicine store person, once you can control that, That is the first stage in which you can control the abuse of drug. Secondly, once you can also control how the drugs are dispensed across the counter, that's a major way in which you can also control that. You see, banning the drugs outrightly will means that even those who need to benefit from those drugs may not have that benefit. Because certainly, codeine-based syrups has its own benefit on the treatment for patients who needed them. If you say you are giving outright ban, it means that those set of people may not have the best treatment at that particular time. Same with tramadol, same with even the opioids. They have what they are needed for in medical treatment. However, our views to government is, number one, the way we dispense our drugs is so porous. We want the government to enforce its law on that. And importantly, the way the drugs are taken from the counter to the users. This is where the prescription right comes in. Okay? Why it is good, desirable, we ban it, is for a short while. The best thing is for us to be able to control a lot of our drugs. Do you know that ordinary paracetamol can be abused? We have people who are abusing it daily. Okay? Though it is an out of a counter drug, but we need prescription right to be able to regulate things. At the time it was diazepam. Everywhere you have to start keeping diazepam and not getting it readily for those patients who needed it. Now today they have gone to codeine-based syrups.
So what role can the citizens play in all this?
We need to
do NMA is not they are not magicians.
Yes.
The government, we're not magicians. It's about us and the people. Just like somebody said someday that for you to have a free and fair election, it's about the people.
Yes.
For instance, Nigeria has a huge figure of about 180 million, and you have less than 500,000 INEC officials, including ad hoc staff, conducting the election. So it's about the cooperation of the people. Yes. So what role can the people play?
Well, the role of the people is about education. Because before one gets to a state in which you start abusing drugs, you have started trying to use the drug. You see, by the time someone starts, most time they don't know they will get to that position in which they cannot tail off that habit. Okay? So we need to start the education at the primary school level. Okay? Or the first 3 years in secondary school. Because these are the areas that the peer pressures and the peer group influence are taken. Okay? Education is important. And the family system in Nigeria is near collapse because of various issues that are confronting us. Is it economic issues? Is it security issues? We have a lot of people not having the direct control of the parents, okay? And they pick things from here and there. And many of them may not be good enough. So I think we need a lot of education, a lot of orientation, and a lot of enlightenment.
What about those who are already addicted and the thing has been banned? What can happen? They still have a right in the society.
Yeah, certainly those who are addicted needs medical intervention. They needed to be treated. And the way to take them off that drug is harder than not starting at all. So that's why we always say prevention is better than cure. But those that are addicted actually need medical therapy. And it can take a quite long time to be able to bring them back into their normality before they started.
Okay, well, naturally one would expect having you on set on a program like this, I should be asking what's your vision for NMA, but you are coming at a period where there's a lot to do within the medical sector in Nigeria. So what's your position regarding the strike? NMA's position now?
Certainly NMA's position is that Juhesu has a right to ask for what they want. Juhesu does not have a right to ask for parity with doctors. Doctors believe, and we believe that the relativity must be maintained at all times.
But is there anything NMA can do to stem it for them to call off the strike?
We are pleading with them that it does not make any major sense for them to be pushing for relativity, because it will bring a lot of storm, uneasiness within the medical profession. Go everywhere. It is not in Nigeria. Medicine is not only practiced in Nigeria. It's practiced all over the world. They should go and see that there is always relativity between the pay. And in fact, the relativity in Nigeria that we are talking about today is totally close, not as that in developed country. For developed country, maybe 5 to 2 to 1.
Okay.
But Nigeria is about 1.5 to 1 to, it has been closed.
Okay.
But even with that, doctors still continue working. And I think that is where we disagree with them. And we told them, this is not beauty contest. The central point of why we are working in a different hospital is the patient. And we must not lose that. Any patient who comes to the hospital comes primarily to see a doctor.
Okay.
It is doctor now that will say, look, I have done this, I have assessed you this way, go this way, go this way. Okay? And once the patients are taken up, they are taken in the nurses. It becomes the property of the nurses. Okay? A doctor enters the ward, he greets the nurses, they work together. And the two major professionals that are actually the mainstream professionals in the hospital are the doctors and the nurses. And our view is for us and the nurses to work very closely in this regard. We are pleading with them. They know the truth. Let us work together. And let us have the interest of our patients. Nigerians are dying day in, day out. And I don't think it's good. Okay. If government now says, look, let us recapitulate, give them some of the increment they are asking, yes, we are happy with that. However, that relativity must be there. Okay. Once it has been disrupted, certainly we will have no rest in the health sector.
Well, what will Dr. Faduyile be doing differently from other enemies?
Well, certainly
enemy ESCOs.
Yes, certainly the first thing we want to do that we are hoping within the next 1 to 2 months is to make sure that the Medical and Dental Council is reconstituted. The MDCN as it is the regulatory body for the doctors, our profession, the teaching, and the work environment. As it is, the MDCN has not been in place for upward of 3 years. What it means is that we are largely unregulated. Okay? And I want to say that the MDCN was dissolved about the same time the governing councils of the universities were dissolved. However, ASU came back and there were a lot of underground pressure, and the second week, the federal government reconstituted or returned all the governing council members in all our universities. And today we have doctors that we have a lot of things that we needed a council to be able to regulate. It has not been set up. Other allied health boards or councils have been set up. We want to pursue that. Okay. We want to also see that the health of Nigerians become a center focus for NMA. We want to give a lot of public alignment. What we believe is that we have to do a lot of education. We have to correct some misinformation, misconception. We want to do it all over the country. Okay.
Justice, if you say the health of Nigerians is central to NMA, yet health services or medication generally, the affordability becomes a problem. Yeah. Is it central to NMA?
Yes, certainly. That's part of the things we are pushing. If you see our communique, we discuss about the universal health coverage. Because today, out-of-pocket payment for health is outdated and it cannot be sustained. As you are, as I am, we are salary earners, and there is no way that at every month we collect salary, we keep maybe 10% or 20%. Let me keep this money in case I fall sick. Nobody does that. Okay? What it means is that the moment you fall sick, you have to look for money anywhere. Many times we don't have money in our pocket, and that adequate treatment may not be in place. But when we are talking about universal health coverage, one, we must make sure that the National Health Insurance Scheme is well established. Today, the National Health Insurance Scheme is at an abysmal low level of enrollment. We want to talk with the government, both federal and state, to get more people to enroll. And what that means is that at any time, any enrollee can get to the hospital and get an adequate treatment. Okay. Just going in without spending extra money. It will afford the hospitals to be able to stock the drug, get adequate personnel in place, because they know that some capitations are coming. I can afford the Nigerians the opportunity that at any time you are sick, you do not go and start patronizing quacks or roadside drug seller. You can go to the hospital, receive adequate treatment. Okay, so universal health coverage is one of the cardinal points in which we are pushing. We are also pushing for the primary health care center to become more effective. Today, when we are talking about health, most of us think of the secondary health centers, which are the general hospitals, and the tertiary health centers, which are the federal medical centers or the teaching hospitals. But most Nigerians are in the rural areas, up to 70%. Okay? And the way they can afford adequate, appropriate health is when they can get it at their location. So many people die during childbirth because they are taking them from one location to the other. There are so many researches that has shown that one of the major causes of death in pregnant women is because of the transportation system. Okay, so once the primary health care centers are properly managed, which is one of the things that doctors, Nigerian Medical Association is advocating, I can tell you that the indices in health indices in Nigeria will go up. Apart from that, we want to see that the National Health Act is implemented. The Nigerian Medical Association was in forefront to have that bill passed. We have to, in 2004, we have to do a work for us to get to the National Assembly and ask them to get it passed. We thank God it was passed, and it was sent to the government, to the president. It took a lot of advocacy, a lot of pressure before the government at that time signed it into law. And now we're in 2018, up to over 3 years or going to 4 years after it has been signed. There is nothing that the government has done to make sure that they effect the act.
Okay, a few states have attempted this. They said they want to jack up efficiency at the primary health care level. Yes. And hospitals are put in place, doctors are employed and sent there. In a matter of weeks, the doctor leaves. Is NMA doing something about this?
Certainly, these are some of the issues that we have seen. Look, for health to be affordable to everybody, doctors and health professionals must get adequate remuneration wherever they are. Today, we have states that doctors are being paid half salary for upward of 18 months. We have states that doctors are not being paid salary for upward of 6 months. We have states that a doctor received X money in the state and their counterpart in the federal institution received 3X money and they are doing the same work. Certainly, when we are talking about brain drain, we can talk about international brain drain and intra within the country. The brain drain you are seeing is that if the conditions at those places are not good, it cannot work. One, each state should key into payment of the proper remuneration for any doctor in Nigeria. This is one of the cardinal things doctors are advocating for. And in fact, the National Health Act actually stated that doctors working in the primary health institutions at the primary centers should earn more. They should be compensated. And it is the reverse that is the case. We have so many states who says they can't pay doctors. And once you can't pay doctors, doctors move to places that they have better paid. And we have primary health institutions that are just building. You don't have the adequate expertise, and patients are dying. We have taken it upon the politicians, that health indices, health indicators, and health should be one of the center points in which they will use to campaign to us. It is high time we stopped all these politicians coming into place and telling us that they will build this. They just build edifices, they just bring in equipments, and there are no personnel to man it and to take care of our people.
Okay.
We want to stop that.
What are you going to do with regarding medicine, just like other professions, journalism, we thrive on ethics? We have a lot of medical practitioners, I can't clearly break out the fields now, who are in breach of ethics, and some are still walking the streets. Nothing has happened to them. What are you doing about this?
Thank you very much. This is one of the reasons why we say MDCN should be in place. And let me tell you, it is only medical professions. It's only in the medical profession that our council, not only regulators, actually try us. If a lawyer, for example, goes to court and you have a good case and you lose the case, nobody takes the lawyer to the MBA or their regulatory body to try. If I treat a patient and I was negligent, okay, I can be sued to my council and I can be dealt with. Our council has a tribunal that is at the level of Federal High Court. Okay? So we must first of all know that MDCN and medical profession is a council that believed in the finest way of presenting of professionalism. Secondly, once the council has not been set up, many things cannot be done.
Okay.
So majorly, we needed the government to do what is necessary. Set up this council so that we can have the full benefit of MDCN.
Okay.
Thirdly, and most importantly, is that our laws are now archaic. There is an urgent need that we must improve the law. Okay. Let me give you some instances. About 10-20 years ago, in vitro fertilization is not in place. Technology has brought it. Even those people who have sperm that cannot make a baby, you can harvest the sperm, then get the good one outside, then use it to fertilize the womb, and that person will have a baby. Today, there is no law regulating in vitro fertilization. We have a lot of charlatans, including medical doctors and non-medical doctors, who claim they are specialists in vitro fertilization. And they are doing all sorts of, they are reaping money, large amount of money, huge amount of money from the unsuspecting public. Brain organ donation. I know you must have heard about some information, don't go to Ghana, don't go to Egypt, they will take your kidney, they will take. Organ donation is now one of the main way of treating end-stage diseases. Today, our law has no position on that. Okay? We have a lot to do with our MDCN. We needed seriously to strengthen the MDCN. The council must be in place at any rate. And thirdly, quackery. Quackery is one of the bane of medical practice in Nigeria. Everywhere you see all sorts and all manners of medical centers, all manners of hospitals, whatever you want to call it, springing up anywhere. In fact, cleaners in the hospital are opening medical centers. Who regulates? How do we regulate? These are the things we need to do. And unfortunately, the public is not very aware that it is the duty of the government to ensure that they have adequate health. We will tell them, and the government will know that they have responsibility for Nigerians.
Okay, you just talked about the fact that quackery is a challenge, and you have most of these hospitals all over the place. To a point, a cleaner can open a clinic. How do we report this to the appropriate authorities, to NMA or to where? In case maybe I'm a Nigerian, I cite one, I'm convinced it is not supposed to be there, it is quick, it is quackery, it is fake. Who do I report to?
Certainly, if our laws are strengthened, the normal person we should report to are the police. However, MDCN, we want to strengthen MDCN and encourage MDCN. I know MDCN has an inspectorate to pick quacks. But even when they pick them, they report them to the police. And you know how things may go in that respect. However, we want to see when we change or we review our laws to have a more a deeper a deeper way of tackling this quackery. Quackery today is not only in physical hospitals. You know, quackery now is also on the internet. A lot of, you see, I have seen people who will bring one machine and you say put your hand, it will tell you 10,000 diseases that are affecting you. You have somebody who say, yes, my brother used it in UK, and you have a lot of things. Even the quackeries have been encouraged by, I'm sorry, by you people sometimes. The journalists, you hear, you open, you put on your radio, you hear all sorts of things that they are telling people. It is sad. We really need to sit down and take health.
MDCN has taken a lot of positions. Licenses are withdrawn from practicing doctors. Do you have an M&E to check if these doctors have been banned for life or they go somewhere else to practice?
I don't think the problem is with doctors. How many doctors do we have in Nigeria? Maybe 40,000. Quacks goes beyond MBBS. Most of them are people who has no relationship, even with medicine. I can tell you, sometimes they pick somebody about 2 months ago, they say it's a secondary school dropout. And he has a flourishing hospital. In fact, it is to an extent that he cannot write. He will get somebody to write. And he will just say, okay, go and use this, go and use this. He will compound in his thought. And you have Nigerians going to meet them.
Maybe because they think it's cheap, it's affordable.
That is where the education is necessary. And that is where we have to take the government responsible. It is the duty of government. Government cannot shy away. It is the duty of government. It's like you don't have good roads and say, well, I'm taking this dangerous path. You say, because this is the only way. It is the duty of government. Nigerian Medical Association, we tell the government, you have to do this.
That's why
we tell the politicians, these are the things you must do.
The health of Nigerians is central to NMA.
Yes.
Now, if the health of Nigerians is central to NMA and a guy somewhere cannot afford these medical services and he sees a very cheap one, he may not bother about whether it is real or fake. The main thing, he wants to get well. What happens to affordability is a challenge.
Affordability has a lot to do with universal health coverage and has a lot to do with national health insurance scheme.
Okay.
And that is what NMA is advocating.
Okay.
Look, as I'm a doctor. By the grace of God, I'm the president of NMA today. If I have any medical illness that will need me to get 5 million, which can happen to anybody at any time, I will have to perspire. Okay? You look at the television, look at the radio every time, you see this form of look at newspaper. This person need dialysis, he needs to do transplant, they are begging for money. What has government done in good climes? Government will say for all end-stage renal diseases, government is ready to take care of the treatment. Okay. We have places that for all cancers, government will take care of the treatment. In fact, if you see the extent in which medical practice or medical treatment or management is in Nigeria, you weep. The cancer patients are another group of people that you don't want to talk about. They don't have treatment. They don't have radiotherapy. They don't have chemotherapy. The chemotherapy, the drugs for cancer that they will use are terribly expensive that some people may need to buy one every week for drugs every week to the tune of about 1 million. Okay. And they have to take it for months. You have given a mind-blowing perspective here, and I imagine how you will achieve all this within 2 years. Or you just pick out the ones that are quick wins? Sincerely, I think it's achievable.
Within 2 years?
I think so.
Okay.
I think so. And I know that with cooperation of people like you, in the media, with education of people, we can make a significant change. And we must make sure that the government must put money in health.
Now that you have begun to engage, you have engaged the media, I believe this is about your second media outing, right?
Yes.
Maybe I imagine I said, Dr. Faduyile, I'm taking you to somewhere, not a media house now, a big hall, and you meet a cross-sector of Nigerians, mostly the downtrodden, rural-based. say, talk to them on the need to work hand in sync with NMA, what will you be telling them?
Well, I will tell them that it is important for them to know that health is wealth, and for you to seek the adequate treatment for your health, visit the proper health personnel. For example, if someone takes paracetamol maybe 4 days of the week for up to 15 years, it will knock up the kidney. We have people who are given drugs that have more destructive value than paracetamol, and because they don't know what is happening, they keep taking them. They must visit the medical specialist who knows how to treat. It is cheaper. It is cheaper, and it is always cheaper.
Okay. Do you have any collaboration with your colleagues in the diaspora? Because we hear that they are doing a lot out there. They have attained so much. In short, I stand to be corrected that I hear if you take out a percentage of Nigerian medical practitioners in Europe, US, name it, it might collapse. Are you collaborating with them?
Yes, before I answer that question, I want to send a poster. How come products are doing so well outside and they are not doing well? Yeah. The difference is equipment and enabling environment. And these two things can only be done by the government. And to your question, we have association of doctors in diasporas, in Canada, in Germany, in US, in UK. In fact, they all attended our meeting. So we're having super collaboration with them, and we are expanding this, the scope. Okay. And I can tell you, a lot of them are itching to come home and help what is happening. We need the government to provide the enabling environment.
Although I may not expect you to put a timeline, do you have a plan to do a medical outreach across various ailments, maybe to the NTA, during your own time as NMA president?
We just did one in Abaji. Because at every of our NEC meeting, every of our NEC that is quarterly, we do medical outreach.
Can I put on record that during Dr. Francis Faduyile's tenure as NMA president, this medical outreach will be done at NTA?
Yes.
Don't go back to the record.
We really wish to do it. But most of MTA people can afford good health. We have so many Nigerians that need those sets, but certainly we'll put it in. We will try.
Well, Dr. Faduyile, it was nice talking with you on Insight. And being a newsmaker, I want to have you once again before the end of your tenure.
Thank you.
We have talked a lot, and I believe Nigerians their horizons have been broadened on the need for the fact that medical health is not all about the government, it's not all about NMA, it's about the people also. Well, your last word for Nigerians? Well,
my last word is that Nigerians do not despair. The Nigerian Medical Association is coming out fully to make sure that the health of Nigerians is taken into the forefront.
Okay.
Especially as we are going into election year. We make the politicians to do the needful so that our health can be taken care of.
Okay. Thank you
very much.
It was nice talking with you, Doctor.
Thank you very much, sir.
Up next on Insight is the Media Review segment. Stay with us.